are drugs excreted from the body?
Right, so drugs are excreted from the body, usually from organs such as the kidneys predominantly, and probably the liver that also metabolizes drugs. And liver will metabolize, and then the kidney would excrete most of them.
Excellent. So you mentioned the kidney. Can you tell me how drugs are handled if they pass through the kidney?
Right, so when they pass through the kidneys, they would go through glomerular filtration, so they'll be filtered at the level of the glomerulus, and then at the other part of the proximal tubule, they could be actively secreted, and also they could go through the distal tubules, and they could be passively reabsorbed as well.
Could you tell me a little bit more about these three processes with some examples?
So in terms of glomerular filtration, it refers to the size of the drug itself. So usually it's said that less than about 600 Daltons would pass freely through the glomerulus. And also if they are unbound, they would also pass through. So common drugs like antibiotics or fluoxetine will go through. Drugs like heparin that are quite heavy or bigger would maybe difficult to go through the glomerulus. And then in terms of the tubules, the proximal tubules, that would be based on the renal blood flow, and that can also be carried by, depending on acidic or basic medium, as it goes through the renal blood flow with some carriers or some charges. And more or less the acidic drugs would always go through easily. And in terms of the distal tubules, as water passes through those tubules, water is usually reabsorbed, and this reabsorption would increase the concentration gradient that can also help in the absorption of some molecules that pass through at this point. And examples of drugs at this point could be furosemide, for instance, with diuretics in the distal tubules.
Mm-hmm. Can you name some examples of highly lipid soluble drugs?
So highly lipid soluble drugs like opioids, fentanyl readily comes to mind, would readily be excreted through this medium as well. And if perhaps there were other factors like disease conditions or age, it could affect the ability of excretion of some of these drugs, where they could probably then cause toxic effects or accumulate and cause some harm.
Okay, so you mentioned age might affect the excretion. Can you tell me a little bit more about the effects of age on the renal drug metabolism?
So age would go in an upward direction. So the older one gets from age 40 up to age 80 and elderly, the normal functions of the body get weaker physiologically, and they will not be able to do as much as they used to do. So there could be some structural changes and some, I'll say, hematological changes that can occur. Structural changes like the number of the glomerulus could be reduced as one ages. I'm not too sure the ages, but let's say 40 and 80 as one gets older. And also there could be some interstitial fibrosis or sclerosis that could also occur in all these age groups as one advances in age. In terms of hematological, there could be the surface area and some other changes could also occur as one advances and affect the ability of drugs to be excreted.
Okay, thank you. And could you tell me what is GFR and how is it measured?
GFR is glomerular filtration rate, and is usually measured physiologically. That's inulin that can be used to estimate how much filtration rate that the kidneys could also measure the filtration rate as the drug passes through the kidneys. It could be affected by a number of factors. And you could also have the serum creatinine levels that could also influence how GFR is measured, but that could also be affected by the muscle mass or the malnutrition of patient, or, both.
Thank you.